have 0 new cases of MPOX as at the last 24 hours, but culminatively we have 5 MPOX cases that have been confirmed in the country. That is Taita Taveta, Busia, Nairobi, Nakuru, and Mombasa. That means this week we have a new case of MPOX, to make it 5. 2 are already healed and they have gone to their respective areas. We are continuing with contact tracing. About 33 contacts are being followed up very closely in Busia, Nairobi, and Mombasa counties, just to verify that the samples that we'll take from them are negative. We have received and processed about 124 samples, and 9 are awaiting laboratory samples. All the others, about 110, are negative. And again, in the last 24 hours, we have screened more than 17,000 people at all ports of entry. And culminatively, more than 650,000 people have been screened on all ports of entry in Kenya. When you have signs and symptoms which are very clear, that you visit the nearest health facility for assessment and treatment should the case be confirmed. Again, we also are advising that it is important to avoid any unnecessary travel to countries that are reporting MPOX outbreaks at this time, and equally avoid direct contact with suspected and confirmed cases, because if you're caring for such a patient, again, use personal protective equipment. It is important to self-isolate if you suspect you have MPOX. Also avoid close contact with live or dead animals, because as you very well know, these are zoonotic diseases. It is important to avoid close contact with anyone showing MPOX signs, and especially sexual contact on the same. Yes, we confirmed the 5th case this week of MPOX in the country. It was involving a 29-year-old female from Mombasa, a resident of Mombasa, and the patient has been seen at Coast General Hospital. That is on the 28th of August, and the patient is currently in isolation at Utange Hospital, MPOX Isolation Center. So while the patient has no recent travel history to a country reporting MPOX case, the spouse had recently traveled to Rwanda and returning on 24th of August. So he's also hospitalized with similar symptoms in Nakuru, and is the 4th confirmed MPOX case in the country. We are really working very hard to ensure that this disease has been contained and controlled, that the spread is not going to affect more Kenyans as we continue. We also want to reassure the public that our healthcare facilities are fully prepared to diagnose and treat MPOX. And that is why we have collaboration between ourselves and the county government, so that our teams are also trained on preparedness. We have sent information to them, guidelines, to ensure that they follow the procedures that are laid down.